know what your overall lifetime risk of developing cancer is? Is it 1 in 50, 1 in 25, 1 in 10? Well, according to the 2009 Cancer Facts and Figures by the American Cancer Society, it actually is 1 in 2 for men and 1 in 3 for women. This is surprising to most of us. How do we know this? It's the work of thousands of cancer registrars working behind the scenes. I'm a cancer registrar. I'm trained to report cancer data. President Richard Nixon declared the war on cancer in the National Cancer Act on December 23, 1971. This made cancer a reportable disease. Today I will explain the vital role the cancer registrar plays in the war on cancer. I will go over the type of data collected, and last I will give you specific examples of how we've helped. So to begin, what is cancer and how does it affect us? Cancer is defined by the National Cancer Institute as abnormal cells that grow without control and can invade other tissues. About 5% of cancers are hereditary. That means they are caused by gene mutations that are inherited, and the cell is at a very high risk for developing cancer over your lifetime. However, majority of cancers are caused by external factors: smoking, radiation from the sun, chemicals, and organisms. In fact, the Cancer Facts and Figures from the American Cancer Society says that in 2009, an estimated 1.4 million new cancer cases are expected to be diagnosed in the United States alone. This also is a shocking number. However, in the annual report to the nation on statistics of cancer by the Journal of the National Cancer Institute, it's reported that actually this number is decreased for all combined cancers, for not only for death statistics, but also for new cancers diagnosed. So there is good news. More good news is that based on the SEER review, 1975 through 2006, the current survival statistics for 5 years is now 66%. That's up from 50% back in 1977. So overall, we are slowly winning the race on cancer. As you can see, data from cancer registrars provide many statistics. Now I'll explain the type of data that's collected. Cancer registrars collect a wide range of information. They collect demographics such as age, gender, and the location of the patient. They do risk factors and medical conditions that can contribute. They do diagnostic things such as type, site, and how extensive the disease is. Treatment patterns help us tell which treatments are working and which aren't. Annual follow-up helps us to know how long patients are living, give us those survival statistics. And healthcare insurance coverage is kind of an odd one for people, but it actually helps us plan different treatment programs and help our legislatures make better programs for all of us. All of this data is gathered at the local, national, and state level. And hospital registries are the core of their cancer program. They develop do local statistics to see which programs are needed and also evaluate the quality of their institutions. State registries, however, look more on the public health spectrum of things. They evaluate which new programs are needed and also help them allocate money towards those programs. So in your community and all over America, the cancer registrars are working to gather information from all aspects of cancer. Virtually every day, new cancer-related stories are in the news, in your local communities, region, and even national news. On June 17, 2009, the Associated Press published an article on Libby, Montana. This is a little mountain town that had been covered in asbestos soot for 70 years. There was a mine there that closed in the 1990s, and in their production, they just covered this poor little town. The cancer rate in that town for lung cancer was 30% higher, and their mortality had skyrocketed. This clarified them as a cancer cluster area, and they finally won federal money for their cleanup. The town had been, another study published by the Breast Journal in 2007 examined breast cancer factors, found a large disparity in women who were under or uninsured. Their prognosis was found to be worse than those with private insurance. They were diagnosed with larger tumors, more advanced stage, and they received more mastectomies, which resulted in them being disfigured, and also had a much lower survival rate. This research resulted in new legislation by those legislators. In 2008, they produced new cancer screening, targeting those under and uninsured women, and also helped provide better treatment options for them. An increase in childhood cancers was found to be associated with living in high agricultural areas. This study, published in the Environmental Health Perspectives Journal in April of 2008, they looked at the correlation between childhood cancers and people residing in areas where greater than 60% of the total acreage was farmed. They found that they had a significant increase in childhood cancer. And not only that, they also found that there was a correlation between the type of crop grown and the cancer that was found in the children. And so they're doing further studies to try and see what they can do to help reduce this risk and identify which pesticides are the likable culprit for this. These are just a few of the instances we hear about how the Cancer Registrar's data has helped in our local communities and across the nation. Today I have explained the role in the Cancer Registry plays in the war on cancer. First, I've defined cancer and gave you some interesting statistics. Second, I told you the type of information we gather and how we report it. Third, I've given you some examples of how it has been applied in the different communities. In conclusion, I just want to leave you with one last thought. When you hear of new cancer breakthroughs, think of the cancer registrars that are working behind the scenes. And just remember, hopefully with continued research, instead of it being cancer, no cancer, cancer, no cancer, it will be no cancer for us all. Amen.